Radiance Cosmedic Centre delivers all cosmetic procedures including advanced hair restorative surgeries for enhancing the aesthetic look. Dr Mayank Singh, founder of Radiance Cosmedic Centre, is a board-certified plastic surgeon. He is one of the handful number of surgeons in India who is qualified diplomate of American Board of Hair Restoration Surgery. Apart from this, he is the only Indian plastic surgeon who got Dr Shelly Friedman Award of 2017 from American Board of Hair Restoration Surgery. Mr Sandeep Mehta, an actor from Hindi cinema, suffered from extensive hair loss. After thorough research, he identified Radiance Cosmedic Centre.
के बाद बहुत रिसर्च करने के बाद मैं इस नतीजे पे आया कि अमेरिकन बोर्ड ऑफ हेयर रिस्टोरेशन सर्जरी किए हुआ डॉक्टर जो हैं बहुत कम हैं, गिने चुने हैं, उंगलियों पे गिन सकते हैं आप। और जब मैंने सोचा कि बम्बई से दिल्ली काफ़ी नज़दीक है और ये टॉप 5 में आते हैं मयंक सिंह साहब, तो मैंने कहा चलो इनसे ही मिलते हैं, उनकी सलाह लेते हैं। आज मैं इनके क्लिनिक में आया हूँ यहाँ, अब उनकी एडवाइस लेता हूँ। आई डोंट नो व्हाट ही विल एडवाइस मी।
After completing the basic details, he met Dr Mayank Singh. Phase of consultation started. Dr Mayank Singh then checked donor and recipient area of Mr Mehta, and after that, with folliscope, he checked trichological parameters of hair such as density, hair shaft diameter, and type of hair. Dr Mayank Singh planned to commence hair restoration procedure on Sandeep Mehta.
See, he's almost at a Norwood's. We have a Norwood's classification for baldness, so he's almost at a Norwood's 6 to 7. He's progressing towards 7. The baldness what he's having, we have to have certain realistic expectations. We can definitely give him a good front coverage with his parietal humps on the sides have come down, what is visible in the photographs as well. So this part which has come down, which is visible from the sides also. So in this case, what we can do is, because of his age and his work profile, we can definitely give him a conservative hairline and cover approximately 4 to 5 fingers with reinforcement of the parietal humps. We have few limitations in his case where his donor span in the back is pretty less. His donor density is below average. It's approximately around 65 per centimeter square. And along with that, his hair caliber is very thin and fine. So these are basic demerits, which are straighter and silkier hair. So transplant gives you a very full appearance relatively with a decent density. It can never give you natural densities. But whenever we have thicker, curlier hair with better donor density, we can do a lot of more justice. So what I am planning to do for him is that we can give him a good hairline, starting from a hairline which should be good for his age and his profile, utilizing methods which are techniques called FUT, FUE, both combined, so that we can harvest the maximum number of follicles out of the donor without giving him much scarring in the back, which would be visible even on going on a shorter haircut. And maybe if the need arises beyond that, we can just extract certain body hair also and place them in between the scalp hair to give him a decent coverage and a front profile. That is my aim.
Mr Sandeep Mehta, who had a lot of apprehensions about his hair, was happy with the decision of hair transplant.
पहले तो मुझे शक था कि मेरे ये जितने कमज़ोर बाल हैं, इतने कम है, पतले हैं, सिल्की है, ये सब के बाद मुझे नहीं लगा था कि मुझे डॉक्टर साहब कहेंगे कि मैं आपको कुछ मदद कर सकता हूँ. बट आई एम वेरी हैप्पी दैट उन्होंने कहा कि येस वी कैन डू इट, एंड ही सेड मोर देन 60 to 70% आपका लुक चेंज हो जाएगा.
Very next day, Mr Sandeep Mehta came at Radiance Cosmedic Centre for hair transplant. Radiance Cosmedic was also ready to perform long hair transplant procedure. The entire operation area was fumigated to avoid any chance of bacterial infection. Dr Mayank Singh drew his hairline. This phase needs high artistic sense of the doctor. Hair frontal and the mid of the scalp is marked for graft placement and distribution.
See, hairline is the part of art of the hair transplant. So, अगर आप same hairline हर इंसान के लिए दे देते हैं, it becomes very difficult for us to have that kind of the aesthetic appearance. So, every person's individual race, which country he belongs to, which part of the country he belongs to, what is the hair texture, what is the hair caliber, what is the balding grade at this age, future baldness कितनी जा सकती है, एज के हिसाब से एक जैसे जैसे एज प्रोग्रेस करती है योर शेप ऑफ द हेयरलाइन हैज़ टू गो मोर बियॉन्ड द सेंट्रल पॉइंट, सो इट हैज़ टू लुक मोर कर्व्ड टूवर्ड्स द साइड्स. वो एक मैच्योर लुक देती है और एक नेचुरल अपीयरेंस देती है. अगर इनकी हेयरलाइन मैं अभी फ्लैट कर दूं जैसे एक यंग 24-25 ईयर के लड़के की होगी, इट वुड स्टार्ट लुकिंग वेरी अननेचुरल. देखते ही एक डिफरेंस आपको समझ में आ जाएगा कि हाँ ये कुछ अननेचुरल है. सेकेंड थिंग इज द आर्ट ऑफ दिस, इट वुड डिटर्मिन व्हाट आर द एंगल्स ऑफ हेयर, व्हाट इज द डायरेक्शन ऑफ हेयर, कैसे आप हेयर की अरेंजमेंट कर रहे हैं. ये सारी चीज़ें आपकी एक नेचुरलनेस देती है हेयर ट्रांसप्लांट को. हेयरलाइन की डेंसिटी कभी भी फ्रंटल हेयरलाइन को बिल्कुल डेंस घना नहीं कर देते, नहीं तो वो विग जैसा दिखने लग जाएगा. सो फर्स्ट 1 फिंगर और सो ऑफ द एरिया अराउंड 1/2 to 1 सेंटीमीटर ऑफ द हेयरलाइन, वो वाले पार्ट को हम लोग बिल्कुल सिंगल फॉलिकल से एक हैफेजर्ड वे में अरेंज करते हैं, बिल्कुल फ्लैट टू द स्किन, सो दैट इट लुक्स लाइक अ नेचुरल हेयरलाइन. तो अगर आप किसी हेयर ट्रांसप्लांट को देखकर ये आइडेंटिफाई कर पा रहे हैं कि इसने हेयर ट्रांसप्लांट कराया है, देन इट्स अ फेलियर.
Sandeep Mehta's procedure was started.
This is a basic setup what is required for doing a procedure of hair restoration. We have certain important things. What is first thing is that there has to be a fumigation of the operation theatre to make it completely sterile. So we do it overnight, one night before the surgery and on the morning of the procedure as well. Apart from that, this is an instrument trolley where all of the things which we are using for the surgery is autoclaved one day prior, and everything is ready in this manner that there is no chances of any kind of an infection coming in. Apart from that, the basic platform for the cutting and slivering and separating of each follicle and counting of the follicles, everything is usually packed in a sterile manner. Along with this, we have certain dissection microscopes which you can see right here, under which we would be cutting the follicles out of the strip individually when we do the slivering of the strip into individual follicles. We do have emergency backup. We have a persistent monitor which would keep monitoring his vitals. We usually put an anesthetic test dose just to avoid any complications of the anesthesia. Along with that, we have an IV cannula which is placed just in case of any emergency you need to usually inject something. So we have that route also available. We keep every possible thing which is required for any emergency backup is present in the setup, including a defibrillator and Boyle's apparatus of the anesthesia and everything. God forbid anything goes wrong at any point of the surgery, we are always prepared for those things.
In order to minimize the sense of pain, initial shots of anesthesia were given with vibrator. Procedure started on time. Combination method of FUE and FUT was applied on him. Over 3,400 grafts were harvested. Each and every graft was cleaned and separated under powerful vision of microscope by highly trained team of technicians.
So we started off with the basic precautions what we need for the surgery. We had put an IV cannula and we had seen his vitals, his monitoring, everything was normal. After that, we have given him a local anesthetic block in the back, following which we have extracted his strip, that is the FUT procedure, and we have closed it in double layers with a trichophytic closure with dissolvable stitches which would disappear in 2 to 3 weeks down the line. Now we'll proceed with the frontal blocking of his further numbness in the front. We need to bring it in, following which we would make the spaces for implanting the hair which would be in the natural angles and directions, giving him a decent density in the front.
As a routine practice, the procedure was 100% pain-free.
एक्चुअली मुझे पता ही नहीं चला, जैसे चींटी काटती है ना, बस उतना ही असर हो, पता ही नहीं चला. मुझे अभी तक तो पता ही नहीं चला.
Prepared grafts were implanted. Procedure continued for over 8 hours. After 48 hours, bandages were removed. Mr. Mehta saw himself in a big mirror and then he had post-operation consultation. Before leaving for Mumbai, Mr. Sandeep Mehta expressed his gratitude towards Dr Mayank Singh and the entire team of Radiance.
तकरीबन 9 घंटे मेरी सर्जरी चली है कल. 3400 ग्राफ्ट्स उन्होंने यहाँ और पीछे से निकाल के आगे लगाए हैं, जो आप देख सकते हैं. 7 घंटे तक वो बंदा खड़ा था मेरे साथ और उसके साथ दूसरे 5 लोग थे. खैर मैं तो लेटा हुआ था, पर फॉर 7 hours इट इज़ अ रिगरस जॉब, वेरी डिफिकल्ट टू परफॉर्म, और 100% एक्यूरेसी के साथ काम करना बहुत मुश्किल होता है. मैं तो पहले से ही इस सोच का आदमी था कि अगर दुनिया में भगवान है तो वो विज्ञान है। डॉक्टर मयंक सिंह साहब को मिलने के बाद मैंने भगवान को देख लिया, क्योंकि वो लोग ने जो तब्दीलियां लाई हैं लोगों की जिंदगी में, आप देख सकते हैं, यहाँ तस्वीरें, इंफॉर्मेशन है, उनके पेशेंट्स के बारे में जानकारी ले सकते हैं, गूगल पर है। इट्स मिरेकल। पर कमाल है ये यानी जिन लोगों को बाल कम हैं और वो चाहते हैं कि उनके बाल हों, तो यहां जरूर आए हैं। ये कमाल की जगह है।
Now it was a time for departure. Mr. Sandeep Mehta, who had a lot of confusion and trepidation in the beginning, was smiling with confidence and happiness. And it is the vision of Dr. Mayank Singh.